Welcome to today's medical deep dive, where we're tackling a serious and potentially life-threatening condition, esophageal perforation. Imagine your esophagus, the vital passageway connecting your throat to your stomach, suddenly developing a hole. This is esophageal perforation, and understanding its causes, effects, and treatment is crucial. Let's get started. Esophageal perforation can arise from a variety of culprits. Iatrogenic causes, meaning those related to medical procedures, are unfortunately common. Endoscopies, where a thin tube with a camera is inserted into the esophagus, can inadvertently cause damage. Esophageal dilation, a procedure to widen a narrowed esophagus, also carries a risk. Other causes include forceful vomiting, known as Boerhaave syndrome, where increased pressure leads to rupture. Swallowing foreign objects, especially sharp ones, can pierce the esophageal wall. Less common causes encompass trauma to the chest or neck, esophageal cancer eroding the wall, and rarely, spontaneous rupture unrelated to vomiting. Recognizing these diverse etiological factors is the first step in understanding this condition. Now, let's delve into the pathophysiology. A perforation breaches the integrity of the esophageal wall, allowing gastric contents, saliva, and bacteria to leak in the mediastinum, the space between the lungs. This leakage triggers a severe inflammatory response. The mediastinum, normally a sterile environment, becomes contaminated, leading to mediastinitis, a dangerous infection. Further complications can include sepsis, a life-threatening systemic response to infection, and pleural effusion, the accumulation of fluid around the lungs. The body's attempt to wall off the perforation can lead to abscess formation, further complicating the situation. Ultimately, the cascade of events triggered by perforation can rapidly lead to organ failure and death if left untreated. Esophageal perforation is a relatively rare condition, but its incidence varies depending on the underlying cause. Iatrogenic perforations are becoming more common as endoscopic procedures increase in frequency. Boerhaave syndrome accounts for a significant portion of non-iatrogenic cases, often associated with alcohol abuse and bulimia. The overall incidence is estimated to be around 3 per 100,000 people per year. It's important to remember that this is an estimate, and the actual prevalence may differ based on geographic location, access to healthcare, and specific risk factors within a population. The signs and symptoms of esophageal perforation can be dramatic and often appear suddenly. Severe chest pain, especially pain that worsens with swallowing or breathing, is a hallmark symptom. Patients may also experience difficulty swallowing, known as dysphagia, and pain in the upper abdomen. Other common symptoms include shortness of breath, known as dyspnea, fever, and chills, indicative of infection. Subcutaneous emphysema, characterized by air trapped under the skin, can be felt as a crackling sensation, particularly in the neck. In cases of Boerhaave syndrome, patients may present with a history of forceful vomiting followed by the onset of these symptoms. Prompt recognition of these signs is crucial for timely diagnosis and treatment. Diagnosing esophageal perforation requires a combination of clinical suspicion and imaging techniques. A contrast esophagram, where a patient swallows a special dye that shows up on X-rays, is a key diagnostic tool. The dye will leak out of the esophagus at the site of the perforation. CT scans of the chest and abdomen can help visualize the perforation, assess the extent of mediastinal involvement, and identify any abscesses. Endoscopy can also be used to directly visualize the perforation, but it carries a risk of worsening the tear and is generally reserved for specific situations. Blood tests can help assess the severity of infection and inflammation. The diagnostic approach is tailored to each individual case, considering the patient's symptoms, medical history, and potential risks of each diagnostic procedure. Esophageal perforations can be classified based on their location within the esophagus, cervical, thoracic, or abdominal, and by their cause, such as iatrogenic or spontaneous. Another important distinction is whether the perforation is contained or uncontained. A contained perforation is where the leakage is limited by surrounding tissues, while an uncontained perforation involves free leakage into the mediastinum or pleural space. These classifications are important because they influence the treatment approach and prognosis. Perforations in the cervical esophagus are generally considered to have a better prognosis compared to those in the thoracic esophagus due to their easier access for surgical repair. Treatment for esophageal perforation is complex and depends on the size and location of the perforation, the time elapsed since the injury, and the patient's overall health. Broadly speaking, the treatment options include non-operative management, endoscopic repair, and surgical repair. Non-operative management involves intravenous antibiotics to combat infection, nutritional support through a feeding tube, and close monitoring. Endoscopic repair, using techniques like stenting or clipping, can be used for small, contained perforations. Surgical repair, involving either primary repair of the esophagus or esophageal resection in severe cases, is often necessary for larger or more complex perforations. The choice of treatment depends on a careful assessment of each individual case, weighing the risks and benefits of each approach. Early intervention is crucial to improve outcomes. Preventing esophageal perforation is multifaceted. For iatrogenic perforations, careful technique and adherence to established guidelines during endoscopic procedures are essential. For patients undergoing esophageal dilation, gradual dilation and close monitoring can minimize the risk. Educating patients about the dangers of forceful vomiting, especially in the context of eating disorders and alcohol abuse, can help prevent Boerhaave syndrome. Prompt removal of swallowed foreign objects can prevent perforation. And for those with esophageal cancer, careful monitoring and treatment can help prevent erosion and subsequent perforation. The prognosis for esophageal perforation depends on several factors, including the time to diagnosis and treatment, the size and location of the perforation, and the patient's overall health. Early diagnosis and aggressive treatment are critical for improving survival rates. Recent advances in endoscopic repair techniques, such as the development of novel stents and clips, have expanded the options for non-operative management. Research continues to focus on improving diagnostic accuracy, developing less invasive treatment strategies, and identifying risk factors to improve prevention efforts. The future holds promise for even better outcomes for individuals facing this challenging condition. Thanks for joining us for this overview of esophageal perforation. Remember, this information is for educational purposes only and does not substitute for professional medical advice. If you suspect you or someone you know may have esophageal perforation, seek immediate medical attention.